And the coronavirus vaccine is expected to be available before the end of the month.
Bexar County hospitals are preparing to get the vaccine out as soon as it arrives. Erica Zucco live in the medical center this morning with more on the plan to vaccinate Bexar County. Erica, good morning.
Good morning, Sarah and Stacia. Yeah, well, at least one of the vaccines is expected to be reviewed by the FDA on December 10th. That's next week. And then days later, they could potentially start to administer those vaccines. So how's it going to happen? Well, University Health System CEO talked with Bexar County commissioners yesterday, and they say first they're going to start with health workers. There are about 9,000 of them just in University Health System before they start rolling them out to more vulnerable populations and then ultimately the general public. But there are some complicated things to consider here. Here's what's tricky. Both Pfizer and Moderna require 2 shots weeks apart, different amounts of time. So they got to track each patient and make sure they get their vaccines at the right time. And for people with jobs reluctant to let them take time off, or people without reliable transportation, there are going to be additional challenges to work through. So this whole process is going to take a pretty long time. For now, though, the focus is on getting locations with adequate storage up and running and getting those healthcare workers vaccinated.
We're in the process of qualifying 27 sites within University Health System that can distribute the vaccine. Originally, again, because of that priority list, it'll be to folks on that priority list. It'll be first responders, other workers like that, people over 65, people with pre-existing conditions. And then subsequent to that, we think probably towards the end of the first quarter, there'll be the general public that doesn't fit into those categories.
And as of right now, it's expected that the vaccine doses themselves will be free to patients, but there could be costs to administer the vaccine that would likely be passed on to insurance providers. Reporting in the medical center, Erica Zucco, KENS 5 Eyewitness News.
Thank you.